Hello, everyone. I am Hiro. I am a student at University of San Francisco. This presentation is about ageism. Typically, when you meet someone new on the street, the first thing we do is to judge the person based on their first impression. Then we go on to determine whether we like the person or not. Although this was a great way to detect threat back in the caveman days, in today's day and age, we might offend someone by doing that. Because along with likes and dislikes, we tend to assume other things about the person as well. For example, when we see an elderly person, we might perceive them as slow, forgetful, fragile, maybe a little bit stubborn. However, in reality, your grandma might have a VO2 max of 55 and outperforming you every hike at Yosemite. Meanwhile, you are gasping for air at the first mile mark because your diet only consists of boba and pizza rolls. When you see a child, you might perceive them as stupid or inconsiderate. However, in reality, your little brother have memorized an entire periodic table, but he's also considerate enough to act stupid, so our feelings aren't hurt. Ageism is absolutely a real issue that many older adults have to go through on a daily basis. There are three definitions of ageism. First, discrimination based on someone's chronological age. This is common among workplaces, where older adults are considered too old to work, they're suggested to retire, and often subjected to harassment regarding their age. Second one, determining roles and capabilities based on someone's age. In the previous slides, I already mentioned a few examples of these. Perceiving elderly as slow or fragile, or perceiving children as stupid. These are all assuming their capabilities at doing something, whether it's physical or intellectual. Third is judging and stereotyping based on an age group. Now, all of the things I mentioned earlier are stereotyping them because they're generalized into categories. Now, the reason I chose this topic is because I've realized that younger generation might not think about how it feels to be old as much as they should, thus neglecting the consequences of their unintentional ageist acts on older adults. Since I work at the airport, I often catch myself doing that. When I see an older couple trying to load their luggages, I automatically want to jump in and help, without asking first whether they need my help or not. Maybe they're totally capable of what they're doing, and by jumping in, all of a sudden, might make them feel they are incapable. Every year, life expectancy is on the rise across the globe. It is no surprise because technology is advancing at a rapid rate. This chart is from economics.com, showing various countries and their life expectancy growth from 1980 to 2016. By the time we notice, there will be more elderly adults than ever before. Also, recently with the COVID-19 pandemic, there has been an increase of ageist content on the internet and social media. With everyone being stuck at home, I feel like it is more likely for elderly to be exposed to these negative contents regarding them and the novel coronavirus. This may have a huge impact on the mental health of the older adults, as well as their quality of life. Which brings us to the next slide. This article was published on April 5th, 2021 by Silva et al. The study integratively reviewed literatures on ageism in context of coronavirus pandemic. The literatures were gathered from various peer-reviewed sources such as PubMed, Web of Science, and Scopus. From the results, researchers have found that ageism may contribute to the increase of elder abandonment, which will result in loneliness, depression, anxiety, and isolation, with the older adults taking a huge negative impact on their mental health. In addition to this, the abandoned older adults may be subjected to abuse as they are left vulnerable with inadequate resources. The researchers also took a look at Twitter. They found that many derogatory comments and jokes about older adults in the context of coronavirus. I'm sure we all are familiar with the hashtag boomer remover by now. Obviously, that's one of them. Also, there were criticism regarding resources allocation and intensive care being only focused on older adults. And many of these tweets and comments were targeting specifically the elderly community instead of the organization. They would say something like, they, as in older adults, have lived their lives, which is a messed up thing to say. Simultaneously, the media is not helping at all by provoking conflicts between generations. And the frustration manifests into anger and hatred, which could lead to further abuse in innocent adults. Now, more than ever, older adults are required to medical care. The COVID-19 pandemic have pushed the limits of medical facility across the globe, and I'm sure many of you are going to medical settings as your career. So I will tell you this right now: don't be an ageist. This next article focused on the perception of ageism by the patients in the medical settings. This 2017 study estimated the prevalence of and identified factors associated with reporting ageist stereotype threats in a medical setting using a nationally representative dataset. Results show that 8.31% of the participants over the age of 50 felt that they were being judged by the medical staff. This is approximately 8.5 million older adults who are feeling this way right now in the US. The main factors are due to previous experience of discrimination in the context of age, very poor self-perception of aging. This is more likely to due to the stereotypes that they put on themselves, and having control over one's health. This creates an untrustworthy environment for the patients, resulting them not want to come into the hospital or any medical setting, in fact. And their condition will get worse because they don't do anything. And they will have to come in anyways, usually through ambulance. And then their medical bill will usually skyrocket. And this vicious cycle will repeat with many patients, and that's going to be a major problem. So how can we make this better? There are two levels of ageism that we will have to tackle. One is the structure level, where social institutions reinforce systemic discrimination against older persons. This is usually formed over time, a culture norm that's formed in the workplaces. And second one is the individual level, where individuals have negative opinions regarding aging or the older adults. Unfortunately, this is often seen in families, although they were seeing less aggressive, but it's more damaging mentally to the older adults since it's coming from a loved ones. Now, a few solutions. To any social issues, spreading awareness is the number one key. Addressing themes through public policies and social media to educate the people on the importance of the matter, more people will be aware and are willing to spread the voice. In order to reduce the intergenerational tension, developing solidarity and respect for the older adults are necessary. In the medical setting, however, there are two aspects to it. On the hospital side, enforce staff training and regulate the hiring process is necessary on the hospital side. And for the patient side, they will have to improve on self-perception of aging as well. Of course, they will need some help by the professionals for that, so they can improve their perception of aging, which means they will have to get rid of their stereotypes that they have, the social norms they've built up over the years, and basically not be as negative towards the concept of aging. And thus we can improve ageism drastically, and hopefully we discontinue the vicious cycle and nobody will be ageist in the future. These are my references. Thank you for listening.